When using the ABL blood gas analyzer, you receive a patient report which reveals the acidity, the level of oxygen, and carbon dioxide in the arterial blood. The report also contains a calculation of the level of bicarbonate. It's important to maintain a normal pH level in the blood. Therefore, the body constantly makes adjustments to keep a strict pH level, a process known as homeostasis. The pH level can be affected by, for instance, metabolic or respiratory disturbances. The body tries to maintain balance with body buffers, among others, and keep a certain bicarbonate PCO2 ratio with compensatory respiratory or renal responses. The respiratory response is quick, as the lungs increase or decrease the ventilation of carbon dioxide, which begins within minutes to hours of an acute acid-base disturbance. The renal response is slower, as the kidneys alter excretion of acid or alkaline within hours to days after an acute acid-base disturbance. When the body is maintaining a proper acid-base balance, it looks like this. But diseases, intoxication, injuries, and other disorders can threaten this balance. A simplified categorization of acid-base disturbance is respiratory alkalosis, respiratory acidosis, metabolic alkalosis, or metabolic acidosis. Respiratory alkalosis is a condition that may occur due to alveolar hyperventilation. This leads to a decrease of PCO2 in the blood, making the blood more alkalotic, and consequently the pH level is increased. If the respiratory alkalosis persists for a longer period of time, the renal system will start the process of compensation by retaining acids and increasing the excretion of buffers, mainly bicarbonate. Respiratory acidosis is a condition whereby prolonged decreased alveolar ventilation leads to carbon dioxide accumulating in the blood, which makes the blood more acidic and causes the blood's pH level to fall. In this case, the kidneys compensate by excreting acids, mainly hydrogen ions, and retaining several buffers, including bicarbonate, in order to counterbalance the low pH. Metabolic alkalosis is a condition where there is a decrease of hydrogen ion concentration, accompanied by an increase of bicarbonate concentrations in the body. This will be reflected by an increase in the pH level. A typical respiratory response is hypoventilation, which will cause the carbon dioxide level in the blood to rise, a compensatory mechanism, which may or may not be complete, but will make the blood more acidic. A renal compensation might follow in the form of retaining acids and increasing the excretion of buffers, mainly bicarbonate. Metabolic acidosis is a condition with a low pH due to accumulation of acids or decreased metabolic buffers. In the blood gas analysis, this condition shows as a decrease in bicarbonate. People who suffer from metabolic acidosis may start to hyperventilate in order to decrease the concentration of carbon dioxide in the blood. And after some time, the kidneys will compensate by retaining buffers of mainly bicarbonate and by increasing the excretion of acids. Determination of the anion gap is an important step in the diagnosis of metabolic acidosis. The anion gap is calculated from the formula, which represents the difference between the primary cations presented by sodium and the primary measured anions presented by chloride and bicarbonate. When we talk about metabolic acidosis, a normal anion gap acidosis is characterized by a lowered bicarbonate concentration, which is counterbalanced by an equivalent increase in chloride concentration, and thereby a normal cation-anion difference is maintained. For this reason, it is also known as a hyperchloremic metabolic acidosis. Normal anion gap hyperchloremic metabolic acidosis usually derives from loss of bicarbonate or diminished renal discharge of acids. It could also be due to large supplements of IV solutions containing chloride. An elevated anion gap indicates that there is a loss of bicarbonate without a concurrent increase in chloride. This can be caused by an accumulation of acids, for instance lactic acid, or toxins acting as acids. The ABL blood gas analyzer measures and calculates the respiratory and metabolic status of the patient, including anion gap, which will aid your diagnostic decisions. Watch the other videos to learn how to perform an arterial puncture and how you can read the report using tic-tac-toe.